So, what is auscultation, right? So, auscultation is an assessment technique to rule in or to rule out any cardiopulmonary dysfunction. So, this is a really helpful assessment tools for us physical therapists, since this is readily available and it's very easy to perform once the PT knows each landmark of the lungs. Each landmarks for auscultation. Right? So, chest auscultation is an excellent tool to assess one's ventilation, especially after any treatment procedures. Okay, so auscultation should be done for each segment of the lung, and the examiner must note the intensity, the pitch, and the quality of each breath sound that the patients do. So we need to compare those breath sounds actually to the left and to the right lung. So, and the examiner must move their stethoscope from a cranial to a caudal manner. Right? So, we also need to take note of the abnormal and the normal breath sounds. So, what we want to hear are the normal breath sounds, while we must be alerted if we hear any abnormal breath sounds. So examples of normal breath sounds are vesicular, bronchovesicular, and bronchial. So if we hear those, we must not panic and we must know that these are normal when we auscultate segments of the lung. So some examples of abnormal breath sounds are the wheezing, the rhonchi, and crackles. So if we hear this, we must take note that there might be an obstructive or restrictive lung disease that the patient has. All right. So before I start the auscultation, I just like to give some reminders. So before we auscultate, we must make sure that we use the diaphragm of the stethoscope. Okay. So we also need to make sure that we place the stethoscope, the diaphragm of the stethoscope, firmly on the patient's landmark or firmly on the patient's segment of the lung. And we want to place it directly against the chest wall. Okay. So we also need to make sure that the tubing of the stethoscope does not interfere with our examination, because if the tubing interferes, we will not hear the lung sounds properly. Next is we need to make sure that the auscultation procedure happens in a quiet room. So if the room is noisy, we cannot focus, and we will not be able to hear the lung sounds properly. And next, we need to properly drape the patient, because this examination technique will involve the patient removing their upper shirt, or we can put them in a gown, because this procedure will involve the stethoscope directly touching their skin, right? And last but not least, we need to put them in a proper position if you want to auscultate. So for some cases, we can auscultate the patient in supine or in prone, but ideally we want the patient to be in a sitting position, be it long sitting or short sitting position. So now for the demo. So now moving on to the demonstration. We'll start now.
Yeah.
Good morning, Miss. My name is Tessie, and I shall be your physical therapist for today. So before we start, how would you like to be addressed?
Just Luis.
Luis? Okay,
Yeah.
so good morning, Miss Luis. What language would you like to speak?
Taglish.
Taglish? Alright. So today, we shall be performing chest auscultation po, Miss, just to rule in or rule out any cardiopulmonary conditions. So this will entail me to use a stethoscope. So this is a stethoscope so I will be using this to listen to your breath sounds. So this procedure will involve some manual contact. So is that okay with you, ma'am?
Yes.
Alright. So I'm going to be starting in the anterior chest of the patient. So remember, quick reminder, so move from cranial to caudal direction, and listen for each segment in maximum expiration and inhalation. Right? So I'll be now donning the stethoscope. So we need to be using the bell of the stethoscope. Okay? So I'm gonna be starting above the clavicle. Sige po ma'am, inhale, exhale. Right. Other side. Inhale, exhale ma'am. Now moving below the clavicle. Inhale, exhale po, miss. Other side. Inhale, exhale, ma'am. Then, moving on, just slightly above the nipple. Inhale, exhale, miss. So, we're now assessing the anterior segment of the upper lobe when we move here. Then the other side. Inhale, exhale. And we go to the medial side. We go to the medial side of the nipple. So we're now assessing the medial segment of the right and left upper lobes. So inhale, exhale, miss. Inhale, exhale, miss. Alright. Then we go to the lateral side of the nipple. So inhale, sige, wait. Inhale, exhale po, miss. Inhale, exhale. Then, last but not the least, actually, in that the lateral side of the nipple, we're assessing the lateral segment of the right middle lobe and the left upper lobe. Now, we're going to be going to the last segment, which is below the breast. So, inhale, exhale po, miss. Right. Inhale, exhale po, miss. So, we're done with the anterior chest. Now, we're going to be moving on to the posterior chest. So now we're going to be we're going to be auscultating the posterior chest, right? So same concepts apply. The patient we need to listen for the breath sounds during inhalation and exhalation, right? So I'm going to be auscultating the first landmark, which is medial to the superior angle. So this is the superior angle, so I'm going to go medially. So inhale, exhale, miss. So I'm assessing the apicoposterior segment and the right apical segment of the upper lobe. Now moving on to the medial to the other side. Inhale, exhale, miss. Okay. Now moving on to the next segment, next landmark, which is medial to the scapular spine. Inhale, exhale, miss. Other side. Inhale, exhale. So we're assessing the posterior segment of the upper lobe when we're here in this landmark. Okay. Next, we go to the medial to the vertebral border of the spine. So this is the vertebral border, just medial to that. Inhale, exhale, miss. Next, inhale, exhale, miss. And we're now assessing for the superior or apical segment of the lower lobes in this landmark. Okay. So bilateral side. So next, we go now to the next landmark, which is below the inferior angle of the scapula. Right about here. Right about here. Inhale, exhale, miss. The other side. Now we're assessing for the posterior segment of the lower lobes in this area. Right? So bilaterally. Next, we go to the 10th rib, just below the inferior angle. So this is the inferior angle. We just go a little bit down. So inhale, exhale, miss. The other side. Inhale, exhale. Alright. So we're now we just assessed the posterior medial segments of the lower lobes. So this is for the bilateral lungs, alright? Next is the lateral side of the inferior angle of the scapula, which is the 6th landmark. So we go lateral to the inferior angle. Inhale, exhale, miss. The other side. Inhale, exhale, miss. Alright. So the last landmark is the lateral side of the 10th rib. So this is the inferior angle. Go a little bit down is the 10th rib. Then we go lateral to that. That is our last landmark. Inhale, exhale, miss. Inhale, exhale, miss. Alright. So what we just assessed is the lateral segment of the upper. We just assessed the lateral segment of the lower lobe. Right? So based on my findings naman po, miss, you can go back to your original position. So based on my findings naman po, miss, there were no abnormal breath sounds naman po. and all of the breath sounds that I just heard were all normal, and therefore you have no cardiopulmonary diseases naman po, or obstructive or restrictive lung diseases that we should be wary of. Okay, so thank you po, Miss.